Hi everyone, welcome to the Menzies School of Health Research podcast series for the NT Youth Health Summit initiative called Youth Choices, Youth Voices, where we aim to hear from young people and specialists about youth health priorities and issues affecting young people's health in the NT. A special shout out to our sponsors for this event, including Hot North, Charles Darwin University, the Northern Territory Government, NTPHN, Bridging the Gap, Ironbark Corporation and Chart Air. Hi, I'm Sarah Clifford, and today on episode 3, I'll be having a chat with Ira Racines from Headspace Darwin and Genevieve Dally from the NTAHC and Hepatitis Council. Ira is the team leader for community engagement at Headspace Darwin and won the 2017 Mental Health Worker of the Year. Born and raised in Darwin, Ira is passionate about educating young people around STIs, consent, and empowering them to take control of their sexual health. Among the many things he's done to promote inclusion and sexual health and wellbeing, he's worked with Headspace and the NTAHC and Hepatitis Council to help them establish an LGBTIQA+ youth support group. And we also have Jen here, who's a nurse with 15 years experience in the sexual and reproductive health sector. She has a passion for advocacy, education, and addressing gaps in services for vulnerable communities. Jen has a Master's in Public Health and a Master's in Business Administration and is the Executive Director for the NTAHC and Hepatitis Council. The rollout of the preliminary forensic kits across the NT and facilitation of a youth-led sexual health clinic have both been passion projects for Jen because providing choice and access to inclusive services is essential to improving health, wellbeing, and in creating a world free from shame, stigma, and discrimination. Welcome to the podcast, Jen and Ira. Thank you so much for joining me.
Thanks for having us.
So how are you both going today?
Yeah, good.
Okay, wonderful to hear it. First of all, Jen, so you've worked in the space of sexual health and reproduction for over 15 years as both a nurse and an advocate. Why is sexual health so important for young people to know about and to talk about?
I think, well, there's lots of reasons, Sarah, but probably I think the biggest reason is that it's a really important part of someone's whole well-being, but often a really neglected part. So due to shame, stigma, and other issues around discrimination, it's often an area of people's lives that they don't have the opportunity to talk about, be curious about, and also be armed with information to look after themselves. So services like the Sexual Health Clinic are essential in addressing some of those issues, particularly for young people.
Absolutely. And Ira, you've been involved in that sexual health clinic at Headspace. Can you tell us a little bit about how it began, who's been involved, and what does it look like for a young person who's accessing that service?
Yeah, I think it all began. Part of the work that I do being in community engagement is being able to educate young people around their sexual health and wellbeing, around mental health and wellbeing in general as well. But sexual health is a bit of a passion project of mine. So there were a lot of discussions happening within our centre, just noting the importance around sexual health. So in terms of how that started, I think there were just some conversations that started between our agency and also the Sexual Assault Referral Centre, being SARC. And that was sort of it sort of just grew from there. But I was also really lucky, having contact with young people in our community, just being able to talk about sexual health a little bit more and just identifying that actually there weren't really too many resources that they could access on a local front that they might be comfortable going to. So what that looks like for our service now, knowing that we've got this sexual health clinic that's running in partnership with different agencies, is that young people can come to Headspace to, get support around their mental health and wellbeing, but actually also being able to streamline it into the conversations around sexual health as well.
That's amazing. That's really, really cool. So healthy relationships are such an important part of sexual health. What advice do you both have for young people in talking about their partners, about sex, STIs, consent?
I'd happily make a comment on that. And I suppose just really quickly going back to what Ira was speaking about, the origins of the service, I think it's really important for us when we're talking about partnerships to recognise that this is actually a project that's funded through Territory families in response to the Domestic Family and Violence Framework. So it's looking at healthy relationships, it's looking at consent, as well as the kind of more, kind of pathological issues that people might experience with their sexual health. So it's a really holistic approach to sexual health care that's led by the young people. So I think that's a really important part that kind of sets the clinic apart from, say, other GP clinics or places where young people might access services. So getting back to talking about how young people might share information about sexual health. Yeah, I think it's really important to make sure that the information that you've got available to you is accurate, that it's comprehensive, and it acknowledges diversity. So a lot of the sexual health education and sexuality education that's presented in schools is very binary focused and doesn't acknowledge or even go as far to celebrate diverse sexualities and genders. So as a young person or a person in the world, it's really important to find accurate, good sexual health information and then have the opportunity to share it with your peers.
Anything you'd like to add on that?
We've got lots to add.
No, I think just in that sphere of, I guess, in terms of my advice for young people, I think being able to just have those conversations with their respective partners. I think it's a conversation that maybe young people might not have the skills or the tools just yet, but sometimes it's also avoided just in general, knowing that it's about sex, which is quite an intimate space for a lot of young people and people in general. So I think my biggest thing is just reminding people that it is something that you can talk about, and it is an important part of who we are as people, not just as an individual, but also within our relationship dynamics.
Yeah, that's amazing. I completely agree with everything that was said. So for young people, we've talked about having conversations with their partners or people that they might be sleeping with. In terms of having those sort of conversations with healthcare professionals, you know, reaching out, making appointments, even just bringing up these topics, what advice do you guys have? Because that can be quite scary for actually a lot of people, not just young people.
Jen, do you want to go first?
Sure. I think, and you hear a lot of comparisons made around things like when someone's accessing a sexual health service for the first time, they have no idea what to expect. It's something completely new. In the same way, when you go out to dinner or go to a restaurant for the first time, there's lots of nuances and ways that things happen that you just, if you've never done it before, you just wouldn't know. So I think for young people, can be quite useful if they can make contact with someone that might be able to offer them a bit of guidance or support or talk to them about what they can expect. So it's really amazing having Ira and his position and the work that he does with young people and even amongst their peers. So seeking out someone that's been to a sexual health service that might be able to, you know, just allay some of those fears that people have. It's inevitable. It's a new thing. People feel super nervous. They're worried about their confidentiality. There's all sorts of things going on. So yeah, again, arming yourself with information can really help.
Yeah, and just to kind of add on to that, yeah, I guess in terms of advice for service providers, like from that particular level, I think being able to put aside our own maybe biases or unconscious biases, because sometimes young people are going to talk to you about a lot of different things that you've never like heard of before, or, you know, I think just adding on to what Jen said, it is really important in terms of information for us as service providers to get informed about a number of different things, like to keep up to date with maybe things that are happening in the sphere of young people, to minimize the surprises, but also be able to embrace those conversations again about sexual health and using them as learning experiences. Obviously, it's not always appropriate to be learning from our young people when they're coming to us for assistance, but that in itself can be an opportunity to connect. But I think at the end of the day, it is about, you know, developing ourselves as professionals in the space working with young people.
So speaking about professionals, obviously this podcast is both for young people, but there were also going to be service providers attending the summit. You guys both live and work in Darwin. If there are professionals listening who would like more information, they'd like to get better at engaging with young people around sexual health, what would you suggest as kind of their first port of call, I suppose?
So look, in terms of engaging with young people, I think just remembering that they're just people, that they can have conversations. It might be on a different level, but I think, again, just going back to what I was saying, you know, being open, being, you know, if you're not sure of something, like sometimes young people are the best teachers. You know, we as service providers or educators or, you know, whatever profession, we're not always going to be the experts about everything. So sometimes it is actually really cool in that particular space to be able to learn from a different perspective, because young people just see the world so differently. Yeah, that's one thing there.
I totally agree. And I think sometimes by acknowledging that you don't have all the information, it can shift that power dynamic that sometimes exists between the young person and the service provider, which is a really important step to them receiving really good quality care. So I think, I totally agree. There's also lots of good training opportunities and courses available, even in Darwin and in Alice Springs. So family planning do provide a really great comprehensive sexual health course. I think it's a week-long course. And NTAHC also delivers training for workplaces around sexual and gender diversity, Trans 101, and we've also got some other education that might be relevant to someone that's wanting to build their skills in this area.
And just adding on as well, like I guess advice as well, like don't be afraid to reach out to other agencies if you aren't sure. We've all got resources, so being able to work together to share the knowledge that we all have rather than just sitting in all different silos. That's something that I am able to do in my role as community engagement, but much like with NTAHC, with all the trainings that they can do, in my role, I can also provide, conversations and just workshops just around specific things of working with young people, focusing a little bit more on the mental health and wellbeing aspect, but definitely being able to throw in some conversations around sexual health as well.
That's amazing, guys. That was really comprehensive. Thank you. So we'll shift slightly back to young people now. So if I was I kind of am young, 25, but maybe a younger person, and I had some sort of concern, whether that's around my relationship or I think I have an STI, what would be my first step in reaching out to get help or get support, perhaps?
So the first thing that I would say would be, in terms of thinking about who you would initiate that conversation with, even before anything actually happens in more of a preventive space, I would actually encourage young people to actually think about one or two people that they trust right from the get-go, so that when situations like this do arise, that they already have those people identified. Obviously noting, especially with our sexual health, if we've been exposed to an STI, it can be quite a stressful and anxiety-provoking situation, and it actually stops us from thinking relatively clearly. So identifying those people in that particular time can be challenging. So that would be my first step as like a preventative kind of thing. But definitely, I think if you find yourself in that position, then just remember that, as service providers, we're all here to support you, to provide that assistance that you might be needing. So we realize and totally acknowledge that taking that step forward and asking for help is really daunting, but it is the thing that we recommend, because we are absolutely here to help you, and we'll do what we can to support you.
Anything to add, Jen?
No, I fully support what Ira said there, exactly that. And just, getting that reassurance that you need, that these things are so common and they affect most people at some stage in their life. So it's not a super weird or tricky problem that you're trying to address, even though it probably feels like that. And then, booking in to speak to someone through the clinic. So getting in touch with Headspace. There's a clinic number that people can text or email if they've got questions. So that's usually a good place to reach out and then get some more information.
Amazing. Thank you both so much. And before we wrap up, Ira, I've seen a video of you posted on the socials by Headspace Darwin with you getting showered in hundreds of condoms. Can you tell us a little bit about what was happening there?
So that was just one of the social media sort of promos that we had envisioned to help promote the sexual health clinic. And it was actually a bit of a... call it a bit of a dream of mine just to have that happen, and it was just a really funny moment. So I shared it with one of my colleagues and she was like, yes, we absolutely have to do that. So so one day we just went and did it, and we just thought it would be a little bit of fun, because conversations around sexual health don't always have to be really serious. Using condoms, we get talked to a lot about that all the time, be it in schools or even just going to our GP. There can be a little bit of fun, an aspect of fun in talking about sexual health, because it is a very normal topic. It is part of who we are. So just trying to normalize those conversations just with a bit of humor. Like, it doesn't hurt in that sense.
I laughed. I found it very funny.
I'm glad.
And is there any kind of final takeaway messages that you would both like to give to young people in the NT about, it doesn't even have to be about sexual health, but about their general health and well-being?
Probably my message would be that, things when you're a young person can seem so intense and in the moment, and just to kind of have this sense that things shift and change, and your experiences at this time in your life aren't necessarily defining. So That's my takeaway for young people, totally unrelated to sexual health.
No, I think my advice would be, look, looking after yourself can seem like such a mammoth task, because as people we are quite complex, and I think just reminding people in general, like both young people and adults, like there will be a stage in time where we will need to seek that support. Sometimes the support we seek might feel a little bit different because we might find ourselves already experiencing a situation. But yeah, like I think we're really lucky in Darwin that we have a really good sense of community, and everyone is already here to help us out if we are going through some tough things. So just remembering that, yeah, we're all here, we're all in this together. We're all going through similar experiences, so it's okay to speak up about some of this stuff.
Thank you both so much for your time and for your very, very wise words. I really appreciate them, and I'm sure our podcast listeners will as well. So that was the third episode of our Menzies School of Health Research podcast series for the NT Youth Health Summit initiative called Youth Choices, Youth Voices. If you can, please support the Youth Health Summit initiative by getting in touch via the Menzies School of Health Research website. Thank you for listening. Please join us again next time.